Hello, everyone. This is Dr. Mike Chu again, physical therapist and certified dementia practitioner. And we're coming to you here. I'm interviewing a special person for today. I got Miss Karen Malone. She's actually a physical therapist too. And her main and her specialty is actually stroke, So we're here today to interview her and pick her brain about the different causes of stroke, the different types of stroke, and also what are the different interventions or treatments that we can do if you have a patient or a loved one that has dementia at the same time has a stroke. And because that is like a very complicated case. Imagine you have a stroke patient and a dementia patient. So here is Miss Karen right now. She's very knowledgeable when it comes, and I'm very, very happy to introduce you to her. So hello, Miss Karen.
Hi. It's great to be here today.
Awesome. Well, first of all, we want to know where you're from. I mean, what state here in the States are you at?
Sure. I'm in St. Paul, Minnesota.
Mm-hmm.
So I've been here about 6 years. Before that, I spent 20 years in China.
Oh, wow. 20 years in China. So if we got any listeners out there or people watching in China, I hope
That'd be great.
We got limited internet access there, but those underground Chinese people there.
Yes, absolutely. Yeah.
Well, could you tell us what are the, first of all, where do you practice?
Well, I have my own mobile practice.
Mm-hmm.
So I go into people's homes and help them exercise right there in the convenience of their living room and work with their spouse or whomever. So it's been really very good. And I've had experience in skilled nursing facilities and home health and other places, but I really like the home setting.
Excellent. Well, that's so good. We wish we got more people who specializes in stroke like you. So did you get any special certification to be a stroke provider or something like that?
I haven't, but when I first graduated, I lived in Illinois when I was going to school. And then when I went out to California, I got to working at a hospital there, and all of the therapists were NDT certified, neurodevelopmental technique.
Yeah.
So I would come a half an hour early to work for quite a while, and they would teach me the things that they knew. So I really learned firsthand. And the whole hospital setting, it wasn't a very big department, but everyone was using the same technique with the patients. So the nurses, the speech therapists, the occupational therapists, and the physical therapists were using a lot of the same techniques. And it made a world of difference. So this meant that patients were positioned in bed the way they should be to help promote more activity on the involved side and to decrease tone or whatnot. And they were being transferred towards their involved side all the time. So they were getting that input from the nurses, the speech therapists, occupational and physical. And it just was great training. So I did that. And then when I went over to China, I actually taught from this, it's called a book called Steps to Follow, and by Davies, PT. And so I used that technique, and I taught quite a few Chinese people how to do stroke rehab. So I've been over it in English and Chinese. I know it pretty well.
So you know how to speak Chinese, Hokkien, Mandarin?
I had to speak Mandarin.
Wow.
I didn't use a translator. So I studied Chinese the first 3 years I was there. And then I did all my teaching in Chinese.
Xie xie.
Ah, 谢谢你啊.
Well, anyway, for the sake of our listeners, Karen earlier mentioned about NDT. NDT basically means neurodevelopmental techniques. Am I correct?
Yes,
Karen?
you're right. Yeah.
So neuro means the brain. Developmental is basically the development and techniques. So these are the techniques that therapists and nurses and doctors use how to, not to really recover or regain, but at least to improve the remaining functions of your stroke patient. Yes, this is a dementia page, but majority of our dementia has what you call vascular dementia and can also be caused by stroke. So stroke and dementia are really, really almost together. So that's the reason why I asked Miss Karen here to help us teach you how to manage and take care of your stroke patients who has dementia. So I really like what Miss Karen said about, the different techniques, starting from the bed and to sit up, getting out of the good side, and then to the whatever, side or stroke side or whatever, because my recommendation, follow Karen Malone's page, because she's been putting a lot of videos on how to move your patient, exercise your patient specifically, because just imagine you got a stroke and dementia patient, and they've been getting out of the bed on the right side of the bed forever. For like 80, 60, 70 years, they've been getting out of the right side of the bed. And then all of a sudden they had a stroke and they've got a weakness on their right side.
Mhm.
Now, how can they do that? So the techniques that Karen will show you and teach you in her page are very useful. That way you can, use this to your actual patients or your loved ones. So am I correct, Karen?
That is very correct, and I think probably one of the biggest obstacles when you're working with somebody who is suffering from dementia is that getting them to exercise is not always very easy. Getting them to engage in exercise doesn't make any sense. So the nice thing about NDT and just understanding how the body works is that you can put a lot of things that are therapeutic into functional activities. So while you're rolling or while you're sitting up, you can be placing their involved arm in the bed, and encouraging them to sit up over that side just while you're talking to them. You don't have to say, now we're going to practice sitting up. That's not going to make sense. And when they go to wash their face, just wrap a washcloth around that involved hand. And as you're talking to them, just say, we're going to wash your face now. Okay, let's put this hand up to your face. And you're giving them a therapeutic input because you are involving the involved side, but it's just a functional activity. That will make more sense.
There you go. I love what she said. If you are listening right now in this group, Alzheimer's and Dementia Support Group or ALZ Prime, you know what she said? She's using meaningful activities for the patient. It doesn't have to be a specific 10 reps, 10 sets of whatever exercise. It needs to be meaningful and functional and for that patient, because the more meaningful and more interesting to your loved ones or to your client, the more they'll do it. So look what she said. Listen to what she said. She said washing your face. Who doesn't wash their face? I mean everybody washes their face, so that's very functional.
Yeah.
Put a washcloth on the affected hand and they'll do it. So
absolutely.
That's a very good technique.
Another really great one is they finish their breakfast. You cleared the table. It doesn't matter if the table's messy or not. Again, you wrap a cloth around their hand, or you find some kind of a mitt to put on their hands and just say, you sit on that involved side and you say, now we're going to just wipe the table. And you could probably spend a lot of time just helping them move that arm and say, come on, help me. Oh, Rich, there's a spot over there, whatever. It's all functional. If it's going to make sense, it's going to make sense in a functional time.
I love that. We also use that on dementia patients.
Ah, good.
So that's very good. Folding clothes and stuff like that.
Yeah, but you just have to be a guide on that involved side. That's the added part to this. If they can't move that side, then you become the guide of that hand.
Awesome. Well, before we go further and get lost in the translation, right? What is the causes of stroke? What are the causes of stroke? I mean, can you help us explain it to our listeners?
Sure. You can have blood clots that form due to like atrial fibrillation in your heart, or you might have clotted arteries, and a clot will break off and go to your brain, and you'll have a clot in your brain which will cut off the oxygen to that part of the brain. All right, and that's like a little plug there, that's just not allowing that part of your brain to get what it needs. So it has to be treated right away. Oftentimes, if you get to the hospital soon enough, then they can give you a drug that will break up that clot. Another kind of stroke is when the actual artery in the brain opens up. It's an aneurysm, and then it will leak blood into the area. So that also will affect the oxygen to an area of the brain. So that becomes the damaged part. And how much damage is there will depend on whether you got treatment sooner or not, but also just the extent of how big the problem is. So that's going to play out then in how much deficit you're going to have on that involved side.
Is it true that if it's your right side of the brain is affected, left side of the body is affected? Can you explain that to us?
Yeah, that's the way you're made. So the right side of your brain will control the left side of your body, and the left side of your brain controls the right side of your body. So that means the person will notice early on in a stroke that maybe part of the mouth is drooping, So
Hmm.
say that side of the face is drooping, you can't smile. So that's one of the things, if you think somebody might be having a stroke, you say, can you smile? And you might see that it's kind of crooked, that one side will go up and one side won't.
Hmm.
And they may feel kind of clumsy on that side. All the times people will get up in the morning or during the night and not realize that they've actually have or having or have had a stroke, and will fall to the ground because that side of their body is just not working. So that can be hard. People can become slurred in their speech sometimes too. So you want to pay attention if you have a loved one that is starting to sound slurred. Make sure that they aren't having a stroke. You want to make sure they're getting checked out. Mm-hmm.
Do we, is there a recommendation that we like a preventative medication? Like I take aspirin now for maintenance and
Yeah,
stuff like that.
I've heard different things. I think that it
Hmm.
is good to do that again according to your doctor. You know, I think they'll be the best one to ask. Some people take a baby aspirin or something like that, but I check that out with the doctor, just to be sure.
Hmm.
But yeah,
How about,
the blood
how about
thin.
with blood pressure guidelines? Do you have any specific blood pressure guidelines that we need to follow?
Yeah, you should be taking your blood pressure every day. I think your loved one needs to have that done to keep track of that. At 120/80 is kind of the normal target, but of course nobody, very few people are like right on the button with that.
Hmm.
So I would be sure and look and see if that blood pressure is creeping up. Certainly over 160 is certainly something you want to get checked. If they're normally kind of low, you even before that I would be getting them checked. 140, 150, just to let the doctor know that there's been a rise
Hmm.
in that top number. So yeah.
Cool. Is there we earlier we talked about the different side, the left side and right side of the brain. Is there any specific side, for example, if it's the left side, they're more like, impulsive or whatever. Is that true?
Yeah, oftentimes that can be. If their left side is actually affected, they have a harder time seeing things objectively, and they'll ask a lot more questions as far as detail and what was that again and whatnot. The left side of the brain has a lot of your language. So right-sided hemi patient will sometimes not be able to speak or not understand speech. They have more
Mm-hmm.
problems. So yeah, it really depends. Your brain is kind of mapped out, and certain parts of the brain will affect different parts of the body. Some people actually get issues with their eyes. So they may find that on perhaps the left side, there's a cutout. So they won't see all their peripheral vision on that side. So that makes it kind of hard if they're moving in their wheelchair
Mm-hmm.
or doing things, or even just paying attention to that involved side. They won't see it, they won't think about it, because oftentimes too, sensation can be involved. So, the brain does so much motor-wise and in cognition and in vision and hearing and speech, all these things. So that's why no two strokes are the same. I think that's one thing you need to keep in mind. Just because somebody's had a stroke, you don't maybe necessarily understand their whole picture. And that's the beauty of having a therapist come in and doing evaluation and finding out where are the deficits. What do we need to be looking for? What do we need to be careful about? What do we need to be telling the loved one about their stroke survivor that will keep them safe?
There you go. I love what you said about there's, what do you call this? There's no two stroke. There's not the same stroke or something like that.
Exactly.
So,
No two are the same.
mhm. Just like dementia, if you're listening right now, Alzheimer's and Dementia Support Group, every part of the brain is different. Every function is different. So if that certain part of the brain is affected, it's going to be
Mm-hmm.
affected. Karen
That's right.
mentioned earlier that left side is responsible for language. So if you have a patient who has dementia
Mm-hmm.
and has a stroke, that specific part of that brain is basically they will lose. Well, I
Yeah.
always correlate this. The left side is the language. Left side is the language, and they will lose that language function. They can be
Mm-hmm.
what you call
Right.
aphasic,
That's
but
right.
on the right side, they still have those reflexes. So they may be able to still cuss you because that's the reflex. They may be able to sing. They may be able to
Mm-hmm.
say rhythm because that's the right side. The right side is the rhythm. That's
Mm-hmm.
the reflexes and everything. So
Mm-hmm.
same thing with stroke. That's what's going to
Yeah.
be
I think
happening.
I think one thing with the language that I always like to remind people of is that aphasia can happen in two different ways. So
Mhm.
you can have expressive aphasia, which means they just can't find the words. They know exactly what they want to say, but they cannot find the words. And the other one is receptive aphasia. So you are not understanding. They can speak, say all the words you want them to say, but maybe they aren't making sense, but they're actually not understanding at all what you're saying, or maybe not much. So, it's hard to kind of figure someone out. And I think that's the harder part when you're living with someone. If you don't really understand what they're facing, it's very easy to get frustrated and maybe to lose patience. So I think that it's very important for the caregiver to get that kind of support where they're reminded, let's remember that your husband isn't understanding everything you're saying. He wants to, I'm sure, but he just doesn't. It's not happening. Or he's got a lot to say, but it's not coming out. He just can't say the words. So you have to be patient with someone. And I think even outside of aphasia,
That's so true.
another a skill that can be totally affected is perception, okay? So maybe they see something sad and they laugh and you go, what? That wasn't funny, Or they might cry when something wasn't sad. I mean, that can happen anyway, just because they can't control their emotions. That's true. But there's also just the perception of what's going on around them, misunderstanding. The cues, misunderstanding dementia and stroke. And by, sometimes you're going to have to explain things to someone, just to understand, so, if they didn't respond perhaps the way you thought they might have to a friend, early on in their dementia, whatever, you might say, that particular situation, was pretty serious, or what did you think about that situation? No condemnation, you can't come down hard on somebody for not having that skill. It's a deficit, it's a handicap. And I think, these are the things you can't see. Now, you can see the problem on the left side, say, or you can notice the speech things, but there's a lot of other brain activity that we don't see.
That's so true. That's so true. That's why it's so hard to treat, stroke and dementia, Well, you mentioned about perception. Is this also what you call the pseudobulbar dementia affectation, or is this different?
Yeah, I think it could be primarily that, but it could just be, the brain before the stroke, left and right side, there's communication happening between them all the time. And when part of the brain isn't functioning and maybe is absent because that part has been so damaged and other parts of the brain are trying to figure out what to do next. That's called plasticity, where your other parts of your brain, the cells are trying to figure out the function that's missing and fill in the gaps. But just that communication from left to right is huge. Our brains are doing that all the time. That's why we're not all just using the left side of our brain and acting a certain way, or using the right side of our brain. And we can be dominant in one side, but those two sides are communicating all the time. So even if I'm very particular and I'm, want everything lined up and everything, part of my brain, but the other brain is like, hey, it's all right, be flexible, Well, we're communicating, we're kind of communicating within ourselves. Is this a time to be really flexible? Or is this a time to be really careful, And so that communication's not happening, we're not getting that voice up in the head saying these things like, this is the time to be careful. This is the time to be, it's okay. It's not perfect. It's all right.
That's so true. That's so true. Well, before we let you go, is there any one last tip that you can tell us, who are taking care of a patient who has dementia and a stroke,
I would just say, be patient. I think patience goes a long way. And if you don't find that you have patience, I loved your daily dose that you did the other day, that we just have to take care of ourselves. So caregivers, take care of yourselves. Make sure you're getting filled up. Find the time that you need to be with, your friends, having fun, or whatever you do. Have that moment, those moments, because your caregiving time is a lot of you pouring out of yourself what that person needs. And that person can't pour back into your life like they used to. And that's a very sad thing. It's grief. You got to go through that grief. But you still have to, hopefully find someone that can come in and relieve you for some time so that you can go out and have those times where you're just taking care of yourself. But try to be patient. If you find that you're losing your patients, step aside. Just make sure they're safe. Go to another room and just have a moment on your own, to collect yourself, because it's a long haul. You know, when someone's had a stroke or dementia, it's not a 2-month, 3-month, 1-year thing, is it? You know, things keep going on. So stroke person needs a lot of understanding, and you need to take care of yourself as a caregiver.
So true. I love what you said. I love you. I love how you kept on reiterating that, because self-care is not selfish. You cannot give something to somebody else if you don't have it yourself. Just like money, you cannot give money to somebody if you don't have money yourself. You cannot take care of somebody if you don't take care of yourself.
Yeah.
So that's our last tip for you today, Alzheimer's and Dementia Support Group. So how can we reach out to you, Karen? I mean, do you have a website that we can reach out to you?
I do. I have a website called PT for Stroke. It's pretty easy.
PT for Stroke.
www.ptforstroke.com. So that's one way. I have a Facebook group that we're very welcome to join. It's called the Stroke Movers, because I'm all about getting people moving and sharing exercises that are helping. So that's what we're all about. I'm sharing quite a few things, and I'm encouraging people to share. It's a relatively new group, but that's my goal, is that people will really start sharing what they've been doing, what's been helping. Because I think we're a community, aren't we? We're not just out there on our own. We don't need to be in isolation. We should feel connected. And there's quite a few Facebook groups that are there to support you emotionally and all these things, which is wonderful. But the focus of my group is really what exercises are helping get you back to functional activities.
Okay. So we will also post the link on this conversation. We'll put down her website and also her group, and that way you can join that group. It's really awesome. You got not just a group that is just a group. This is a group led by an actual physical therapist that can really help you identify how to treat your not really treat, but how to compensate and how to redirect your patients, how to be the best that they can be, not only for your patient, but also for yourself. Because how can you make your loved ones better or your patient better if you yourself is not better? So take care of yourself, be awesome, be great. Again, thank you very much. Check out Karen's website, PT
for Stroke.
PTForStroke.com, and her group. Join that group. It's an awesome group. Again, thank you very much for all you do, Miss Karen. Reach out to her. She has a upcoming course coming out. Wait for that. I know it's going to be awesome. Just imagine, she's been doing this for more than 20 years. She has a wealth of knowledge, and she's taught this in China for how many? 20 years?
Yeah.
20 years.
Yeah.
And she's doing this, and there will be a lot of information. So come and join her group. In that way, you can be the best that you can be, and also for your loved ones. We may not be able to reverse the dementia and the stroke, but what we can do is be the best that we can be, and to be able to take care of your loved ones. So again, thank you very much for watching and listening to our show. Thank you, Miss Karen. Any last parting words?
No, just have a great day and just smile.
Awesome.
Yeah, stay
thank
happy.
you very much. Have a great day, and hope you have a good weekend. Bye-bye. Boom.